So even though COVID has changed, there's one big area that we're very concerned about, and that is long COVID. So what do we know about long COVID? Well, it's actually called PASC, which stands for post-acute sequelae of COVID. Once you've recovered from COVID, certain symptoms persist, and they can persist for months and months and months. Quite hard to define it unless you've got a diagnostic test, because we all get a bit fatigued from time to time, say, and they're using combinations of symptoms now to pin it down. They reckon as many as 30% of people after COVID will have some symptoms of long COVID. That's an awful lot of people. Now, in the vast majority, within 3-6 months, it looks like these begin to resolve. In other words, your body eventually recovers from it. But a subset of these people, it can persist beyond that and be extremely severe. The commonest ones are severe fatigue, brain fog, you can't quite concentrate, breathing problems when you exert yourself. Now I mean walking up the stairs even, you get a bit breathless, muscle aches and pains. Those are the main symptoms, and also kind of anxiety issues as well. And these are very, very serious symptoms. And in fact, in some people, they're extremely debilitating. And all the evidence is suggesting now that a subset of people with PASC or long COVID will actually have heart damage and lung damage as well, and that's why they're having difficulty breathing, because if your lungs are damaged, you can't breathe as effectively. If your heart's damaged, you might get more and more fatigue. There's a couple of options, by the way, as to what's happened. One is the virus might still be there, and remnants of the virus are kind of still irritating your body in various ways, and there is some evidence for that. The second more likely thing is the immune system has beaten the virus. But the trouble is, the troops of the immune system are still agitated and they're still burning away and causing some of these symptoms. Kind of like an autoimmune situation where the immune system's out of control in a way, you know, and all the symptoms are coming off the immune system. That's a more likely reason for it. And sadly, some people have the wrong genetics maybe, or maybe a high dose of virus we think might be part of it, or whatever reason, the immune system begins to misbehave once you've cleared the virus. And they're the main reasons why we think it might be happening. A recent breakthrough has been you can image people's lungs now with a really sensitive sort of device. It's called xenon-based lung imaging, and that's revealed injury to the lungs post-COVID. The regular imaging system is called CT scans. That wasn't revealing this. So again, it's subtle, but there's now a real way to measure lung damage, for example. The second big thing they're trying to do is get markers in your blood that might actually diagnose it, first of all, and then secondly, point the way towards therapies with the idea there as well. So a huge amount of effort now is examining patients. One, it sounds a bit strange, one good part is so many have it, scientists can now study it. I mean, there's 1 million people in the UK, they reckon at the moment, have symptoms of long COVID. That's a great resource for scientists to take samples from those people and study them very, very closely. And all these new insights are coming from analysing all these patients. I'd also say in Ireland, we have a lot of long COVID as well. There's long COVID centres now in all the hospitals. Again, that's a great resource for doctors now to examine the patients and diagnose it, first of all, and then secondly, maybe try to understand exactly what's going on when it comes to long COVID. More and more evidence suggests there might be ways to therapeutically handle this particular situation. First and foremost, by the way, vaccination. Really good study in the last couple of weeks. If you're vaccinated and you catch COVID, a lot lower risk of long COVID in those people. Why is that? The vaccine fights the virus and you get rid of it and the thing can't even start. So the advice, as ever, is take the vaccine to decrease the risk of long COVID first and foremost. Now secondly, if the immune system's off kilter, you can measure that and maybe target this overactive immune process, and in that way then limit the symptoms, and that's where that research is heading in many ways. I'll give you one big example. They found in the blood of long COVID people 3 markers. Now markers are proteins that go up and you can measure them as a mark of the disease. IL-1, IL-6 and pentraxin-3. There's a mouthful for you. These are 3 inflammatory factors made by the immune system that may cause the symptoms. And my lab, in fact, works on IL-1, so we're very keen on this. Now you can imagine, block those and you might relieve some of the symptoms. And again, all the research is heading in that direction. So there may be therapies available eventually to treat this disease. What we're learning as well is fatigue is a huge problem in brain fog. Now that does sort of work out eventually again and go away after a few months, but while you're in the middle of it, rest is actually very important. It's obvious in the way you take a rest. So if we could diagnose someone and say you have long COVID, then the advice is please take a rest. And in fact, smart wearable technologies are being used here because your heart rate's a bit different with long COVID. It can measure even your blood oxygen levels. If they're up, take a rest, because that can really help some of these symptoms. That's something we can do now for a kickoff. So again, there are things you can do now to help handle some of the symptoms of long COVID. Now, the other thing is, if your heart is damaged or your lungs are damaged, again, there can be treatments for that. So it's very important to go to your doctor and get these tests, check your heart. And the doctor might give you, say, beta blockers, antidiuretics. There's various ways to help your heart during long COVID. And again, that can relieve symptoms as well. So now there are things already that we can kind of do to help patients who have these symptoms. Now, as ever with COVID, we're learning all the time. I know that sounds a bit strange. You think we know everything by now. All these studies are really great because we're learning more and more about long COVID. Huge investments going in, by the way. In the UK, for example, a 40 million research programs being funded to study long COVID. Same in the US, hundreds of millions are going into long COVID. So we're learning all the time. But remember, right now, as I said, we can do certain things to help. A diagnosis can relieve anxiety because now you know you've got something that can be treated. So that's really, really helpful. And then secondly, that diagnosis might allow you then to come up with treatments to limit these damaging effects. So again, it's an example yet again of there being great hope through all this science and all this research. And what's also happening is really exciting, I think, is there are many situations where you've got post-viral fatigue. It's not just COVID. And many people who get infected with things like Lyme disease, for example, that's caused by a tick and a bacteria, or indeed the flu, will have post-infection symptoms. And of course, we're learning now from COVID to treat those diseases as well. So the hope here is things like chronic fatigue syndrome or ME will now be tractable through what we learned from COVID. So basically all this great research could give rise to all kinds of benefits, not just with long COVID, other diseases as well, where there are post-infectious consequences. So even though this is with us still, and many, many people are affected, the good news is we're learning more and more things all the time, and I've no doubt at all that over time we will come up with ways to prevent or indeed treat long COVID. So as ever, science brings us great hope with regard to a very important medical question that affects so many people.